I wanted to provide a brief update on another vitally important healthcare issue, the 2019 novel coronavirus outbreak and the Trump administration's response to it. President Trump has made the safety, security, and health of the American people his top priority from day one in our response to the outbreak. Our hearts go out to people affected by the virus, and our gratitude goes out to everyone who has helped respond so far. As we see case counts increase, I want to be clear that we have expected this trend all along. The cases we're seeing now appear to be largely concentrated in community transmission areas in Seattle, Santa Clara County, and Westchester County, New York, while other new cases generally appear to be tied to travel to and from places like Iran, Italy, and South Korea. The United States is the hub of the global economy. It was never going to be possible to hermetically seal us off from this outbreak, and we have said that from the very first communications that we have had to the American people about this. The United States was always going to see a substantial number of cases, just like our wealthy peer countries. President Trump's bold actions, however, to restrict travel and impose historic federal quarantines bought us incredibly valuable time. We've used that time wisely. We've had the chance to get a head start on vaccines and therapeutics. State and local governments and healthcare providers have had time to prepare. We've been able to start ramping up procurement and manufacturing of personal protective equipment like respirators. We were able to formulate a strategic, evidence-based supplemental funding bill, which the President signed into law on Friday. And we've been extremely focused on expanding our testing capability and capacity. By the end of this past week, 1.1 million tests had been shipped out to public health laboratories and private labs and hospitals. These were made by the CDC and by a private manufacturer. At this time, another 1 million tests are available to fill orders or are being shipped. This private manufacturer and a number of other private manufacturers are ramping up production of their tests such that they will have produced an additional 4 million tests by the end of this week. We have always been able to meet the full demand for test orders from public health officials. At no point has a request for a test from a state or local public health department been denied by CDC, and at all times CDC has had capacity to run these tests either itself or through other CDC public health reference labs. I want to emphasize how successful we have been at detecting cases. America is not a country where a case of unknown influenza-like illness goes ignored. Our healthcare providers are working swiftly to identify cases, thanks to the early warning that we sent out to America's healthcare providers. That's how we identified those initial cases, and that's how additional cases are being identified throughout our system. And we're responding as needed with a multi-layered approach. We've been extremely pleased with the constant, productive communications we've been having with our nation's governors in particular. In short order, we will be releasing further guidance about what state and local governments, employers, schools, and families can do and should do to mitigate community spread under various types of circumstances. At this time, the immediate risk to most of us as Americans from COVID-19 remains low. But that risk can be higher for those who may have exposure to individuals who have confirmed cases or for those who have traveled to affected areas. In addition, we now know from the progression of the disease globally that older people and people with serious chronic medical conditions are at higher risk of serious illness, including death. Conditions that raise the risk can include lung disease, cancer, heart disease, stroke, renal disease, liver disease, diabetes, and immunocompromising conditions. The CDC has put out guidance to remind people who fall into these groups and families who live with them that they should be taking particular actions to prepare and to protect themselves. On top of avoiding contact with people who are sick, washing their hands often, and paying attention for particular symptoms, older Americans and those with serious underlying conditions should avoid crowds and places where people gather in groups, especially in poorly ventilated spaces. Information like this can be found at coronavirus.gov, which also has guidance for families, employers, and schools. I want to conclude this part by emphasizing that if you are involved in running a healthcare organization yourself, you should help review the plans that you have, lean in on preparedness, and be ready to execute on any necessary action plans. I want to encourage organizations, as needed, to be in touch with us through our Office of Intergovernmental and External Affairs.